How many times have you heard a patient say, "Wow, that much for an implant?" Or "I had no idea Invisalign would cost so much." We've all been there. High value procedures do come with a cost, which is why in this video, I'll show you what to say to patients when they think your prices are too high. And if you're ready to grow and scale your dental practice, then I have a very special invitation for you at the end of this video. So stick around. I'm Dr. Anissa Holmes here with a new episode of Dental Boss TV, showing smart and growth-minded dental bosses just like you how to start and scale a truly successful dental practice that gets you excited about coming into the office every day. Subscribe to my channel and hit the bell to be notified when I post a new video on Dental Boss TV right here each and every Tuesday. You focus on providing the highest standard of care to your patients. You know that when you recommend a treatment plan, it's because it's truly in the patient's best interest to move forward. Now, we've talked a lot here about how to present a treatment plan in the best possible way in order to improve your case acceptance rate. And we've gone over the importance of verbal skills. If you need a refresher, you can check out this video. But even with the world's best communication skills, sometimes you'll run into patients who are extremely cost conscious and they're going to call you out on your pricing. So in today's video, you're going to learn what you need to do when that happens, how to address your patient's concerns, and how to be truly solid and secure in your own pricing. But first, let me ask you a question. Do you know how much it actually costs to run your practice per hour? Let me know in the comments if you've ever thought about that number. It's so easy to get caught up in caring for our patients. We went into dentistry because we wanted to help people after all. But you're still running a business, so it's extremely important to know your numbers. Specifically, we need to think about the actual cost involved, what it takes for you to be able to run your dental practice and deliver services to your patients. When I work with colleagues inside of my coaching programs, one of the first questions I ask them is, what does it cost you per hour to run your practice? And what's fascinating is that most of us have never even thought about this number, but it's something you absolutely need to know. Now, to calculate that expense per hour, you need to think about what you pay your team, your rent or mortgage, your utilities, your marketing costs, and anything else that you're paying in a given month. And then divide that by the number of hours you work in a month. Once you know your expenses per hour, you're in a much better position to stand behind your fees. Think about it like this. If you have no idea what it costs you to do a crown, if you've never calculated the lab fee, the cost of the adhesive, the etchant, the tips, the burrs for that particular procedure, then you might think, hey, maybe my patients are right. Maybe I should just reduce my fees. But when you know your actual numbers, then you can talk about your fees with more confidence because it actually costs you quite a bit to do that crown once you look at the expenses involved. Let's say that you figure out that it costs you $850 an hour to do a crown and you charge $1,000 for that crown. Your profit margin is just $150. So when a patient says, "Well, doc, $1,000 just for one little crown," you can say absolutely. You don't have to feel bad about what you're charging. You know your expenses and you can stand firmly behind that pricing. You know that your fee is extremely fair based on your expenses, which makes it much easier for you to quote those fees. And it's a good idea to bring your team in on the world of expenses too. Because if they only see what you're charging and they don't know anything about the expenses, it's going to be harder for them to get on board with your pricing. If all they know is that you're charging $1,000, $2,000, $3,000 or more for a procedure, and they have no idea of the actual cost involved, a high quality lab, adhesives, time spent with the patient, and so on, it looks like you're making up those numbers. Once your team sees the expenses and they realize that your pricing is grounded in data that is based on your actual costs, they'll be in a much better position to present those fees to your patients with confidence. And it's really only after you've done this work on getting clear on your expenses and understanding your profit margins that you can shift into how to present a treatment plan effectively and work on those verbal skills. It's critical that you and your team don't have any issues with pricing. And then you can focus on setting the stage with your patients so they understand that they're making an investment. When you start the conversation with a question like, what are your goals for your teeth, your mouth, and your smile? Then you're going to get answers about strong and healthy teeth, about having a beautiful smile. That gives you a chance to follow up and ask them what they don't currently like about their teeth, which lets you get to the heart of what's really bothering them. When a patient tells you she hates the brown spot on her filling, or they're talking about pain, or they tell you that they don't like the way the dark line looks on their gums, that's going to give you the opportunity to let them know that you have the ability to help them. You can drive the conversation about giving them a solution to a problem that's clearly bothering them. And yes, it will cost money, but you can frame that investment for them properly. And that only happens when you and your team are confident in your fees and you know your numbers. I want you to be super confident in all the numbers in your dental practice. And I want to help you grow your practice so that you can focus on serving your patients the way you really want to. So I'd love to invite you to check out my Practice Accelerator. It's the #1 on-demand program for dentists and teams to grow, scale, and market their practices fast. You can check the link to the accelerator below this video. Also, if you want to join a community of dental bosses just like you, I have a Facebook group where over 15,000 dental bosses are already learning and growing. Join us in the Dental Boss Movement Facebook group if you want support and training as you grow your dental practice. The link is below this video. If you like this video, please let me know by liking it below. Be sure to subscribe and share it with other dentists who can learn from it too. And don't forget to comment below with Dental Boss if you're ready to talk about your pricing with confidence. See you in the next video.